Good afternoon, everybody. I'm called Dr. Chaima Elizabeth. I'm going to first year MMed. I'm going to take you from the first part of case presentation. I'm presenting AF, who is 6 years old male, Muganda by tribe. He is Muslim. The next of kin is a grandmother. The residence is in Wasiko. He admitted on the 16th of September 2015. He had been in the ward for about 32 days, and the main complaint was difficulty in breathing for 2 days and rash for 1 day, while the child have been treated for tetanus. A history of presenting illness: he was well till 1 month prior to admission, and when he developed one episode of muscles is bad, and there were locked jaw, stiff neck, following by a prick to the scrotum because he fell on his nail. He was admitted to Stanfield and was being treated for tetanus. While on the ward, on the day 26, he developed a dry cough and difficulty in breathing, which was constant without periodicity. On the 5 days later, the child developed high-grade fever that was constant, relieving by analgesia, and there were no aggravating factors. Immediately, these were followed by non-itchy generalized rash starting from the face down to the trunk and then to the rest of the body, including the extremities. In the review of system, cardiovascular system, there is history of swelling of the feet and hands, no palpitation, no difficulty in breathing on lying down, no history of wakening at night due to breathlessness, no history of excessive sweating, no history of syncope. In GIT, there is watery loose stool, 4 motions per day, no blood in stool associated with projectile vomiting of all feet, no abdominal pain, no yellowing of the eyes. CNS, no history of convulsions, no loss of consciousness, and no post-ictal micturition. In genitourinary system, the urine is yellow, pale yellow, no change in micturition habits, no dysuria. ENT, no history of ear pain or discharges. Musculoskeletal, no history of joint pain or swelling. In the past medical history, this is an index admission. The serious status is unknown, no history of blood transfusion, no history of surgery, no history of trauma, allergy, and the child was not known history of chronic illness. Antenatal, natal, and postnatal, the grandmother could not provide the details. Immunization, the child has never been immunized at all. Growth and development, the child being growing normally, as the grandmother said, and not yet in school due to financial problem, and interact well with peers. Family social history, they lived with the paternal grandmother and with another 2 siblings, brothers. The age are 8 and 10 years old. They are all alive and well, but the immunization history of the sibling is unknown. They live in a 3-room rented house, which composed of 4 people in total. The source of water is a borehole in the company of the home. Summary: this is a 6-year-old boy being managing for tetanus on measles isolation ward, never been immunized, developed measles-like rash with associated cough, difficulty in breathing while on the ward. On examination, sick-looking child on oxygen via nasal sprung in distress, a febrile, temperature was 37 centigrade, well hydrated. There is a hyperemic conjunctiva and a purulent itching eye discharge. He has generalized maculopapular rash and non-pitting tender edema, non-pitting, non-tender pedal edema, no corneal ulceration or pitotic spots. He has oral thrush and angular stomatitis, but there is no complex spots, no mucopurulent nasal discharge or significant lymphadenopathy. Anthropometric measurement, the weight was 15 kilogram, height is 96 centimeter, BMI for age is between +2 and +3 standard deviation. Mid upper arm circumference was 15 centimeter. On the respiratory system, the pulse rate is 60 beats per minute with subcostal and intercostal recession and supraesternal recession. No chest deformities. There are degrees movement on the left side of the chest, and there is no tenderness on palpation. The trachea was central. Percussion note, resonant bilaterally, equal air entry bilaterally, bronchial breathing here at the left intra-axillary, and the coarse crepitation here over the chest, more prominently on the left side. Cardiovascular system, the extremities were warm, capillary refill was less than 2 seconds, pulse rate 120 beats per minute, regular, full volume, all the peripheral pulses were palpable, blood pressure was 90/80 millimeter mercury, jugular venous pressure was not raised. The apex beat was on the 4th intercostal space, mid-clavicular line. No thrill, no parasternal heavy, heart sound 1 and 2 here normal, and there were no added sounds. Para-abdomen, the abdomen was of normal fullness, soft, not tender, no palpable organs or masses. In the CNS examination, Glasgow Coma scales was 9/15, distributed as I2, verbal 3, motor 4. Had a stiff neck, carnic signs was negative, the pupils were equally and reactive to light. No obvious cardiomyopathies. He has generalized hypotonia but increased deep tendon reflex. No ankle clonus, Babinski sign was equivocal. My impression was measles complicated by severe pneumonia. So the measles in view of conjunctivitis, as you heard from the history, and the rash, presence of rash, severe pneumonia in presence of distress, intercostal and subcostal recession, plus cough and fever. There is also possible aspiration pneumonia. This is from the fluid, because the grandmother used to give fluid to the child. Meningoencephalitis in view of stiffness of neck and fever. Acute watery diarrhea, as I mentioned in the history, there is diarrhea, watery diarrhea, but there is no dehydration. And then tetanus, lastly, because the child has been managing as case of tetanus. Investigation, total white complete blood count and differential. They are all normal, within the normal range. And the liver and electrolytes, just a creatinine and urea, they are reduced. But the liver function test, normal, and blood film for malaria was negative. Management, this child had been managed with ceftriaxone, IV ceftriaxone, IV metronidazole, and then tetracycline eye ointment. He received vitamin A, and then he continues on the treatment of tetanus, chloropromazine and diazepam. And he also on oxygen and suction PRN. Follow up on the ward. On the 15th, the temperature was 37, the pulse was 120, and the respiratory rate was 60 beats per minute. The spasm was there, and there is absent spasm, but there is crepitation and distress. While on the 16th of October, the temperature was 36.5, pulse rate was 100 beats per minute, respiratory rate 60, the spasm is not there, and then the chest findings were, there were crepitation and still in distress. On the 17th of October, the temperature was 37, the pulse rate 90 beats per minute, respiratory rate 90, and then the spasm is not there, crepitation and distress. On the 19th, the temperature 36.5, the pulse rate 60, the respiratory rate is 45, the spasm was not there, and chest findings, there were crepitations and distress. Currently, the child is improved, no spasm, no fever, respiratory distress become less, the child is more responsive, rashes is resolving, and now feeding orally. Thank you.